So, from your time here so far, or for the rest of the day today and through Monday, is there anything in particular that you found exciting, new, that may affect the way you practice?
Eventually it will. There's a lot of very interesting basic science in the development now that eventually will affect the practice. For example, there's a lot of information coming out about microbiome, the bacteria that we live with, and how they affect our metabolism. We have about 10 times more bacterial cell in our body than our own cells, bacterial cells than our own cells. And the mass of bacteria is a little over 1 kilogram. They metabolize everything that gets into GI. Most of it is in the GI tract. Some of it is on our skin. And the metabolism of foods that we take is affected significantly by these bacteria. So I think that is the next interesting problem we're going to look at, how this microbiome should be managed in patients with diabetes, whether through diet or some other treatment, possibly even antibiotic therapy of some kind. This is not going to affect our practice today, but I would say within a few years it will be very much on everybody's radar. The other interesting food component that we have to begin to think about is what is called AGEs, advanced glycation end products. These are very delicious things that are made when food is cooked with dry heat. The best example is this browning of the turkey, this crust, the most delicious part, which is also the most dangerous as far as your health is concerned. These are advanced glycation end products that are formed from protein and fat when glucose is attached to it, usually during food processing with dry heat. And they increase inflammatory responses and the risk of diabetes, and also are important in the aging process. In fact, the diet that is devoid of these products is called ageless or AGE-less diet. There's some information about this at this meeting, and this afternoon we're going to have a meeting with the American Diabetes Association officials to see if some of these recommendations could be incorporated in the dietary recommendations, official dietary recommendations of ADA. So these are a couple of things I think that are new, but will probably affect the care of diabetes in the next few years.